Hope Channel, changing lives.
Good evening, and you are welcome to the consulting room. You know that on Mondays at 8 p.m. we join you on your screens and in your homes, in your offices, wherever you may be, and we talk about health issues. And today you might have seen the flyers around. We are talking about childhood cancers. Cancer, the diagnosis of cancer or being told that you have a cancer at any age is very upsetting. So you can imagine how your child would feel, especially if the child is a bit old, or how some parents feel when doctors or health workers tell them that their children have cancer. And because we don't want it to get to the stage where you have no hope, we have two very big women on this platform today with us. We have joining us on Zoom, Dr. Gloria Amponsa-Kodia. This is not her first time here. You've heard her talk a lot about children. I know she's one of the most passionate people when it comes to issues concerning children. She's a pediatrician, and she's also the executive director of Healthy Kids Foundation. And joining me in the studio for the first time is Dr. Ernestina Shandorf. I got her name right. She's also a pediatric oncology fellow. So for those of you who don't understand that one, so she's somebody that has specialized and is specializing again. So she's a very smart woman. So I'm very happy that both of these ladies are joining me today so that we can all learn about childhood cancers or pediatric cancers. If you hear me say pediatric, it just means childhood or enkwara. It's not any big word. As always, we have cocoa milk sponsoring the show. It's a natural milk that is good for everybody. It's good for children, and it will help their bodies fight all illnesses. So maybe I'll ask the specialist if cocoa milk will help fight against cancer, but that's just by the way. So in the course of the conversation, you can join us. You can send us your questions, your suggestions, or your comments on our number 055-968-0066, and we would read them and answer them duly. We'll go for our very first break, and when we come back, we will zoom right into the conversation concerning childhood cancers.
The Seventh-day Adventist Church Ghana presents The Coming King, a 10-day Bible lecture series from the 12th to 22nd of October 2022, 6:30 p.m. each night.
There is a coming King who has answers to all our challenges and cares in this life. You may have your doubts, but that is why I'm inviting you to join us in the Bible lecture series, where we believe to find answers to our challenges, and your life will not be the same. God bless you.
The Coming King, a 10-day Bible lecture series, live from 12th to 22nd of October 2022, 6:30 p.m. each night.
Only on Hope Channel Ghana and all 7-day Adventist churches in Ghana.
Cocoa dairy-free coconut milk. Cocoa dairy-free coconut milk is a fully plant-based milk, non-curdling in tea or coffee, and is a lovely treat with any breakfast beverage or meal. It contains calcium and vitamin D2 for strong teeth and bones, and vitamin B12 to help boost your blood for vitality. Cocoa is 100% vegetarian and is approved by the Vegetarian Society of UK. It's also lactose and dairy-free, which is good even for people with lactose intolerance. Cocoa, get one today. Cocoa dairy-free coconut milk. Nature's health at your doorstep. For all purchases, contact 027-444-0180. This advertisement has been vetted and approved by the FDA. Cocoa dairy-free coconut milk.
Yeah, welcome back to the consulting room. If you didn't join us from the beginning, you are not too late. We are just about to start our conversation about childhood cancers or pediatric cancers. At first, people didn't used to think that children can get cancer. We used to think that it was only old people that can get cancer. But now I think quite a number of us know that even children can get cancer. So, Dr. Ernestina, what are the, is it so common? Is childhood cancer something that is so common, or is just 1 or 2 children that get it?
Thank you very much for having me here.
You're welcome.
As you rightly said, most of us know about cancer in adults.
Yes.
But very few people know about cancer in children. But cancer in children actually happens worldwide, whether it's in Ghana, US, UK, China, Nigeria, anywhere in the world, childhood cancer occurs. And childhood cancer worldwide, you have like 400,000 children.
400,000? That's a lot.
Yes, being affected by childhood cancer. And can you imagine, 80% of these children are actually in sub-Saharan and lower middle income countries, unfortunately.
That's sad.
Yeah, so childhood cancer is common, but the good thing about it is it's curable.
Okay.
So if you have like 10 children, 8 of them are cured, they live their normal lives, fulfill.
They can grow and become adults.
Adults, like you and
good.
I, become a lawyer, a doctor, a pastor, whatever they want to be in future.
Okay.
However, because of the lack of awareness in our society, we tend not to pick it up early, and that's one of the major challenges in Ghana.
Okay.
In developed countries, childhood cancer is picked up very early because many people are aware that there is something like that, and they are aware that it's curable, so they come early, get treated, and they live their lives.
Okay. So if 8 out of 10 children can be cured, then there's hope. It's just that when you find yourself in this part of the world, then your hope might be smaller, but there's still hope.
There's still
so
hope.
you mentioned over 400,000 children worldwide.
Yeah.
What's the figures? What are some of the figures in our country?
So in our country, using the estimated population size, we are about 30 million in our country. So it's estimated that about 1,400 children are supposed to be diagnosed with childhood cancer. But unfortunately, we see between Kolebu and Komfanochi, who are the major centers for treating childhood cancer, we see just about 400. Meaning
we are expecting 1,000 plus, and we are getting just about 400.
That's like 1/3 of what is expected.
Yes.
So you can imagine the rest of the 1,000 either don't know what is happening and attribute it to something else, or they even die because they may not know that it's cancer.
Okay. All right. So if you happen to see some of these things that we'll talk about during the course of the program in your child, you should know that they are part of the 1,000 that have not yet been seen during that year. So, Dr. Gloria, what are the common types of cancer, especially in our part of the world, in Ghana?
Yes. All right. Thank you so much, Mami, and good evening to your viewers. When it comes to Ghana, the common types of cancer that we see are retinoblastoma, that's cancer of the eye. Then lymphomas are also common. So lymphomas can be seen as a jaw swelling. We have different types of lymphomas. So it could be a jaw swelling or some lumps in the neck or even in the abdomen. So the lymphomas are there. The retinoblastoma, that's cancer of the eye. The kidney cancers are also common. And then we also have the leukemia. So leukemia is blood cancer. These are quite common, but it's also important for people to know that cancer can happen in any part of the body for children. So they can get brain cancers, they can get cancer of the bone, they can have liver cancer, they can have cancer of this small organ on top of the kidney, which is called the adrenal gland. They can also get cancer there. So children can have cancer in any part of their bodies, but the common ones in Ghana, we have the lymphomas, we have leukemia, that's cancer of the blood, we have retinoblastoma, cancer of the eye, and then we have the kidney cancer. So these are the common types of cancer we get in children in Ghana.
Okay, so thank you very much for giving us some of the common ones we should look out for. Dr. Tina, generally we know that people say that we don't know the cause of cancer, but then is there anything that puts children at risk of getting particular kinds of cancer or anything of that sort?
Yeah, so yes, generally childhood cancer is not like adult cancers where you have risk factors, like if you drink alcohol you can get liver cancer, or if you smoke a lot you can get throat cancer. Childhood cancer isn't like that. Usually it's not fault of theirs or their parents.
It just happens.
It just happens.
Nature chooses them.
Yeah, like
sadly.
an accident in nature.
Oh,
so you know, all of us are made up of tiny cells, and every cell is programmed to fulfill a function and then die at a certain age.
Yeah.
However, in childhood cancer, that mechanism of programmed death of some of the cells when your function is done doesn't happen. So that cell, that part of the body, outgrows and overgrows and doesn't fulfill any function, and rather hinders the rest of the body. So that's what causes cancer in children.
Okay.
However, there are some infections that are associated with some cancers, like HIV infection, hepatitis infection, and some viruses like Epstein-Barr virus associated with certain forms of cancer. But that does not necessarily mean that if you have an infection, automatically
you're going to get
a
cancer.
Yeah, it's just been found that there's a link to some of them.
It just means that you might get
increased,
it.
Yeah.
But then doesn't mean that you will get it.
Yes.
Okay, that's good news and bad news, but well, we'll just look at the good side of it. So we'll go for our very next break, and when we come back, we are having some technical difficulties. We'll sort all of that and we'll come back to our discussion on childhood cancers. Please stay with us.
The Seventh-day Adventist Church Ghana presents The Coming King, a 10-day Bible lecture series from the 12th to 22nd of October 2022, 6:30 p.m. each night.
There is a coming king who has answers to all our challenges and cares in this life. You may have your doubts, but that is why I'm inviting you to join us in the Bible lecture series, where we believe to find answers to our challenges, and your life will not be the same. God bless you.
The Coming King, a 10-day Bible lecture series, live from 12th to 22nd of October 2022, 6:30 p.m. each night.
Only on Hope Channel Ghana and all 7-day Adventist churches in Ghana.
The wait for the Physical Youth Campaign is over, and we have been charged to go. Yes, we will go. Adventist Youth on a Mission. Get involved. The Obuasi Estate Youth Federation is organizing yet its biggest youth campaign after keeping safe of the dreadful COVID-19. We will, through this campaign, study the word to prove ourselves strong, train for skills, drill, hike, and play lots of fun games to equip ourselves for His service. Well-planned programs like career orientation and entrepreneurship skills, a night with Celestial City Choir, visit to Barikesi Dam, and Boyinre Kente Weaving Site. We have secured the venue. It's the Adventist Girls Senior High School in Tonso from the 21st to the 30th of December. Register through our website. Visit www.oeyfgh.com. Click on the registration tab, request for token, fill in your details, and make your payments from your mobile money. When coming, don't forget your tents, sportswear, and hiking shoes, Bibles, etc. For more information, contact or WhatsApp 0246 173 817 or 020 546 8765. Be in attendance, for this youth camp will be an experience of a lifetime.
Yeah, welcome back to the consulting room. We are talking about childhood cancers. We've learned that it's very common amongst children. It doesn't just happen to old people. Children too can get cancers. And even in our country, it's estimated that every year about 1,400 plus children should be diagnosed of cancers. But then just about 400 children are diagnosed of cancers in our part of the world. Sometimes, I think if you don't know that there's something wrong with you, you not go to the hospital for them to tell you that this is actually what is happening. So our very next question, which will be to Dr. Gloria, what are some of the things that show, or some of the things that should let me draw my attention to my child if the child might be having something like a cancer?
Okay. So the symptoms actually depend on the type of cancer.
Yes.
If you have cancer of the eye, often what you see in the early stages is a white spot in the eye. So usually they say a cat's eye, especially in the night, it shines like that. Or you might think the person has cataracts. So there's this white
There's
spot
an image showing on the screen.
And then you'd also see that the eye may deviate inwards or outwards, so what we call a squint. And it could be a sign of cancer. So the eye would deviate.
So by the deviation, by the deviation, you mean that when the person is looking at you, the eyes will look, instead of both of them looking at you, one or two of them might look at somewhere else instead of...
Exactly. So they are staring at you, but the eye is shifted outwards or is looking inwards. So that's a squint or the deviation. And then they may also have visual, so blurred vision, so they can't see properly. And if it's a child, what you may notice is that she may bump into things. She used to walk well, but now she bumps into things when she's walking. She's not seeing well. And then if it's not addressed, then the eyeball itself starts protruding. So it gets bigger, and then it seems to be coming out of the socket. That's when it's really getting advanced. And then sometimes it also spreads to the brain. So it can also affect the function of the brain. So the retinoblastoma, these are some of the symptoms that you can see if a child is developing it. And then when it comes to leukemia, which is the cancer of the blood, you may notice that the child has become very pale, quite white, like they don't have blood. So
I was coming to tell you that the medical terms, break it down for us.
I just got myself. I just got myself. So they may look white. You look at the palms are white. You look at the eyes, and then usually the mothers know. So they look at the eye and then say that, oh, the child's eye is looking white. Where we actually press and check for the redness, it will appear white. And then also because the blood level is going down, that's why they look white. They easily get tired. So signs of anemia when they do a little bit of work and then they are getting tired, they may also develop pain in the bones. So this is not a child who is known to be getting bone pain. But then all of a sudden, she or he starts having pain in the legs, in the arms, at the back, and you can't really tell what is happening. She didn't fall or anything. So that can also be a sign of leukemia. And then again, they can also bleed abnormally. So they're brushing their teeth and you see blood coming out. So when they have cancer of the blood, the work that the blood does, one of the things that it does is that it stops bleeding. When there's a cut somewhere, it helps to stop bleeding. But when they have leukemia, then it's not functioning well. So they bleed abnormally. And then again, they can also have unexplained fever. This is not a child who has malaria or has a cold or has diarrhea or some other illness, but they just keep having fever. You go to the hospital, they give them medication, it seems to be resolving, and then they get fever again. So if you have unexplained fever in a child, you should also thinking about leukemia. And sometimes the health workers are at fault. You treat one child for malaria so many times. The child is still having fever, it's still malaria. You should let the child be properly assessed, because fever which keeps persisting or comes and goes for a long time can be a sign of leukemia. And then we also have the lymphomas. So lymphoma is also another type of cancer. What we commonly see in Ghana in children who have lymphoma, we can get a swelling of the jaw. So that child can come and then the jaw is swollen. The teeth, you look into the mouth and then you see that the arrangement of the teeth, this is a child who had nice teeth or the teeth were firm. Now it seems to be shifting or erupting. So this is the jaw swelling that can happen.
So
sometimes
we are seeing a picture, an image of a little, I don't know, a child with swollen jaw. So that's an example of what you are talking about, right? Dr. Gloria?
Which is mumps or, there was, hello, can you hear me?
Yes, we hear you.
Great. So if you have a jaw swelling, which is there for days, you've gone to the hospital, they are saying, okay, maybe a viral infection, which is common in children, mumps, but it's not resolving, you should think of lymphoma. And especially if you look into the mouth and arranged or they are falling off, it can also alert you that this child may have lymphoma. Sometimes they also have a swelling of a mass in the abdomen, so you might feel something in the child's abdomen or tummy, and that can also be a lymphoma. And then sometimes you can also see swelling on the neck, around the neck. You might think, oh, maybe it's one of the swellings, what we usually call a lymph node around the neck, but it's just there. I mean, it's not reducing in size, and it's there, not reducing in size, may even be increasing. So you should think of a lymphoma. And then the kidney cancers too, you can have, you feel a mass in the child's abdomen. The urine may change in color or become bloody, a little bit bloody. Sometimes all you just feel is just the abdomen getting bigger or the tummy getting bigger and bigger, and you may be able to feel a mass there. The other types of childhood cancers, which are not so common but can happen, you can also have a brain cancer in a child. So this child may start having some behavioral changes. So this is a child who used to do things on her own, now may have difficulty dressing up, remembering where she kept her things, and may even not see well, may not smell well, may not be walking. So these are, all the things that the brain does depending on the sites where the cancer is, can also affect these things. So your walk, your the way you see, the way the child smells, the way the child talks, and all that can also be affected when there's a brain cancer. And then I'll talk about the cancer of the bone too. So they may have bone pain, and you see that the part of that body, if it's the leg, it keeps getting bigger. So these are some of the signs of childhood cancers, the different types of cancers. What I will say is that if you see anything different in your child, get the child assessed. As Tina said, we lose a lot of them because they don't come early. So get the child assessed. And if you go to a hospital where they keep treating the same thing but the symptoms are persisting, get another opinion, and let's see what is wrong with the child. It may be cancer, so that they can start the treatment early and save their life.
Yes, yes. So, yes, get your child checked if you keep seeing that your child is getting fever. And please don't mistake fever for what we think fever. Some people have different understanding of fever. Fever is just when the body temperature goes high. So every week your child is having high body temperature. So if you have a child like that, please run quickly to the hospital and send your child. Dr. Tina, so we've heard from Dr. Gloria, and she's told us about the things we should look out for. What do you do as doctors when children come with these symptoms? So that I want you to tell us what you do, so that the parents would know that you are not wasting the time, and what you do is actually beneficial.
Yeah. Yes, so as Dr. Kodia has explained, most of the symptoms can resemble other diseases. Mm-hmm. So it's very important for us to differentiate it and make sure it is cancer. Mm-hmm. Okay, and because cancer, when it starts at one place, it can spread to many other places. Yes. So we need to make sure that we know how far it has spread, mm-hmm. and where exactly it is and what type of cancer it is, because mm-hmm. every cancer has a different treatment. Mm-hmm. So before we start, we do some investigations, some labs. Sometimes you may need scans. Mm-hmm. Sometimes you may need to take blood to the lab. Sometimes they actually have to look at, if it's a swelling, they'll take a piece of the swelling to the lab and look under the microscope to see what type of cancer it is. So once that is done and we have a diagnosis, we all know that having that diagnosis is not an easy thing to deal with for yes. a family. So we usually sit down with the family, and then we talk to them about the diagnosis. Mm-hmm. We counsel them, we provide emotional support, because not everybody can take such news yes. easily. Mm-hmm. So it's very important that our initial counseling is done with a lot of empathy and with a lot of psychological support. For the teenagers, depending on the parents' preference, some would want the child to go through the treatment a little before they would tell the child. Okay. Some would prefer that we would tell the child. Okay. Okay, so we gently do it to bring the child to terms with mm-hmm. the kind of treatment he or she is going to have. So once we do that, then treatment will be started. And with the treatment, there are different ways of treating cancer. Okay. One of the ways is using medications, mm-hmm. so we call chemotherapy. Okay. Okay. There are some you inject directly into a vein. There are some you put into a drip and give. There are some you inject in the back. So there are different types. There are some you actually take by mouth. Okay. Okay. And some cancers will need just chemotherapy. Mm-hmm. There are other cancers that may need chemotherapy and maybe surgery. Mm-hmm. And there are some that may need chemotherapy, surgery, and radiotherapy. Okay. By radiotherapy, it's just like when you're going to take the scan, mm-hmm. the invisible rays that help to produce the picture. Mm-hmm. This time we use a particular range of invisible rays to try and burn the remaining cancer that is left. Oh, okay. Yeah, so that's radiotherapy. So those are the main modalities of treatment for cancer. So once we start treatment, we don't leave the parents alone. we keep on talking to them, making sure that they adhere to the treatment, they don't give up, and they continue the treatment to the end. Because cancer treatment is not like malaria treatment where you treat for 3 days. No, it's not. It's unfortunately long.
Yeah.
Yes, so some may last from like 6 months. Others may last to like about 3 years. The cancers of the blood, you may treat for like
so
3 years.
You'll be going for those medications,
Yes.
doing a lot of labs. I think even as you are taking the medicine, you still do the labs, right?
Yes. So usually, to make sure that we are winning, you need to monitor. If you don't monitor, you wouldn't know where you are. So usually before they take the treatment, we check their blood level because the medications are given at specific environmental conditions. So the blood level has to be good, everything has to be okay before we can give the medicine. So before we give any medication, they would do at least the full blood count where we look at how the blood level is before we give. But during that time, usually during the reviews, in the initial phases, the child may be on the ward. When the child responds well, then they'll be going and coming for treatment on OPD basis.
Okay, so they get well to a point that they can actually go home.
Yeah, sometimes. So usually, when we start early, especially with the early cancers, they respond quite well. So initially, we need to make sure we prepare the body for the medications, maybe 2 or 3 days. When we start the treatment, we also have to monitor how they respond because, like everything, cancer medications and treatment also have side effects. So some of the side effects are some children may lose their hair.
Yes, I was about to ask, you know, when we watch movies, we see people having chemo,
Bald.
they have to cut their hair because they have patches of baldness. We see those things in children.
Yes,
the darkened fingernails.
Sometimes. But it's not all. It's depends on the child. Some children will go through the treatment and nothing happens. Some children will go through it and then they will have the symptoms. Okay, another symptom is vomiting. So usually for every child, because we cannot predict who would vomit and who would not, for every child we give them medications to stop the vomiting.
Okay.
Okay, and another side effect is sometimes their blood can go low, so we need to give them blood. Or if they have a temperature, we need to give them strong antibiotics. But generally, once the child is stable, they go and come for their medications on OPD basis. And that is when sometimes parents relax.
Oh.
Because the child will look well, will look better, will start gaining weight.
I think it's a bad habit amongst most of us Ghanaians. Even with the 3-day medication course, when we take the first day and the second day and we are okay, we just look. But
which is
that's
really
quite
bad.
Yeah.
And cancer is not forgiven.
No.
If you treat it anyhow and you're not serious about it, it will come with a bang, with revenge. So it's very important that when you start the treatment, you go according to the schedule that the child is supposed to go.
Okay, all right. Dr. Gloria, Dr. Tina has told us the things involved, the drugs, the chemotherapy, the radiotherapy. Today, the people are giving us big words. But which people are involved in the management of cancer? Is it just doctors? Is it just nurses? She mentioned something about counseling. So does it involve everybody at the hospital or is just 1 or 2 people?
Okay. So it's important to involve as many people as possible. I mean, people who can actually help with the management. So the counseling, when you have a clinical psychologist, it helps. They are trained and they are able to talk to the parents and the child, if it's an older child who can understand, and psych them, because it's a long journey. And sometimes it may take a year or 2 years, they may relapse, and then they even have to continue. So they need to be psyched up properly. So a clinical psychologist is sometimes involved in the management. And then you also need, of course, your doctors and nurses. So the nurses are also trained to know how to handle these children well. All these jabs and medication they give. I mean, if you have people who are working on these children and they are not sympathetic, it can be traumatic for the children. So we have trained nurses and then doctors who work on these children. Sometimes you also have to involve another group of doctors we call radiologists. So Tina mentioned that sometimes you may have to give the drug, you may have to do surgery, you may even have to give this radiation. So, like the X-rays he talked about, there's a specialized group of doctors, radiologists or interventional. You need them. You may also need the surgeons. So, if the tumor has to be taken out, you need the surgeons. And in retinoblastoma, yes, as a child, so you need the pediatric oncologist, but you also need the ophthalmologists, the eye doctor to help you with the management. There are times that you even have to call the ear, nose, and throat surgeons or the brain surgeons or neurosurgeons to also come in and then help. So it's what we call multidisciplinary. You need the lab people also to help interpret or explain or run the labs and then sometimes help with the explanation. So you need a whole team. It's a whole team, and you shouldn't also forget the parents and the child who are the center of all these. So you need to explain to them whatever step you are taking, how things are going, the progress you are making, and you keep encouraging them to keep fighting because it's tough sometimes. I mean, having to send your child to the hospital to take medication, stay there sometimes for a day or two or a number of days before they come back, and then you have to do this over and over again. So they also need to be involved in the care. So it's a whole team. It's a whole team. Yeah.
Okay. All right. So now we know. There's always been an issue, especially with Ghana health, the health system in Ghana. I didn't want to say Ghana health, the health systems in Ghana, because we are supposed to have a national insurance, but then when I was a student, as at 2018, 2019, some of my colleagues were championing the cause of having Beckett's lymphoma covered by the insurance. Does insurance cover cancer treatment in children in Ghana?
Yeah. So thank you for that question. So in the developed countries, many developed countries, all childhood cancers are covered by...
All?
Yes, in most like developed countries like US and others. Over here, until recently, like late last month, where the government has decided to put 4 of the cancers on the national health insurance.
Just 4? Yes,
but it's a step in the right direction. It takes baby steps.
Well,
Rome wasn't built in a day, so I mean, it's gradual. So now, at least cancers of the eye, the retinoblastomas, the blood cancers, the leukemias, cancers of the immune system, we call the lymphomas, and then cancers of the kidney. They are covered by the national health insurance.
So what exactly do they cover? Because, you know, a lot of us have skepticism about the insurance and what they can offer. What does the insurance offer?
So the current status, I mean, it's still work in progress, but the main thing is most of the medications that we use for the cancer treatment, like the chemo medication, they are quite expensive.
Yeah, it will be.
Yeah, and having these medications covered by the insurance is a big relief for the parents. I mean, it's still in the initiating phase. So we still have some stockouts and some of the medications, but generally, at least even if 2 out of 4 medications are covered, it's a good step.
At least you can use that money to buy egg for the child to eat.
Exactly. Exactly. And, you know, with the national health insurance, the cost of admission, these children are going to be on in and out of the hospital for a long time. And if you don't have national health insurance, even the cost of admission, being on a bed, it's a lot of money.
Yeah.
But with the national health insurance, at least no matter how long you stay, whether it's for 1 hour or for 100 days, you still pay the same fixed amount of, I think, 62 point something Ghana cedis,
That's
which
quite
is reasonable.
Good. Yeah.
Yeah. But if you don't have the insurance, then you pay out of pocket. And depending on the hospital you are in, you may pay from 100 to 500 Ghana cedis for a day of admission. So it's very, I mean, it's very important to have.
Yeah.
So we hope that very, very soon, in the near future, all childhood cancers will be covered by the national health insurance.
That would be a very big
so that you don't have to discriminate, or you have this, so you can get, because very soon parents will be like, how come
we are all here in this department and this one is getting to pay less than. Okay, well,
but very soon we hope all the cancers will be covered.
I hope the soon is soon, because I know Jesus is coming soon, and it's been anyway, that's a joke. So we now know that the insurance, our national health insurance, covers at least 4 of the major cancers that we have in cancers of the eye. So if you remember when we spoke about the symptoms, if you see any white thing on your child's eye, or you can see that the child's eye is doing, I'm looking at you, but I'm looking at somewhere, you have to be careful. I might be smiling saying this, but then I think it's a very serious thing. Yes, and a lot of us take it for granted. So if your child is having any of the things we spoke about, maybe if we can reiterate the symptoms, Dr. Tina, some of the symptoms that
some of the symptoms. Number 1, if your child is having any symptoms, seek help early.
Yes.
Because childhood cancer, the earlier the better, the less expensive, and the better the outcomes. So seek help early for any symptoms you don't understand. If you go to, as Dr. Gloria said, if you go to a hospital, your child is always having temperature, it's not going, seek early, get a referral to a higher facility. Okay, then the eye symptoms, as you said, any whitish spot in the eye, okay, it's a cause for alarm. Or if the eye is red or bulging or looking in different directions, you know that it's a problem. And usually when you see the white spot in the eye, it's early. So if you start the treatment early, you can actually preserve the eye. But if you don't come early and the eye begins to bulge and bleed and swell and have a discharge, then the treatment will have to be, we have to remove one eye and put a fake one there for us to save the life of the child. So it's very important. The early presentation really, really matters. And for eye cancers, outside, 95% of these children are cured and live a normal life. So it's very important that we also present early. Okay, and then the swellings that Dr. Gloria talked about, it can be on your jaw, in your stomach, in the arms, and usually the cancer swellings, they may not be painful. So the child will be playing and doing whatever they want to do, but you need to bring them to the hospital as soon as possible. Okay, and then some of the signs of brain cancer, like change in behavior, change in the way they walk, they talk, or even subtle things like change in handwriting. You need to present.
Change in handwriting.
Yeah, sometimes it can be very subtle. Just a change in handwriting of the child can let you know that no, something is happening up there. Or signs of leukemia, if the child is white, or having abnormal bleeding for no reason, or getting bruises without any like accident or fall or anything, then you should be worried. Or bone pain. Yeah, you should be worried and should bring the child as soon as possible.
I made Dr. Tina talk about the symptoms because maybe you joined the show just now and you know you're talking about cancer, but then Dr. Gloria has already spoken about it. When we want to make a point, we say it more than one time. So you've heard the symptoms. Don't stay home and be there with your child. That's maybe I'm in hospital. That's the attitude of a lot of us, which we are trying to educate all of us about, that it's not good. More so, it's a child. You utia or hospital. you take yourself to the hospital. Don't sit there and tell the child that what's wrong home, you are bothering me anyway. Dr. Gloria, our last major question before we go to concluding remarks. So people have a lot of issues, especially with health workers. They're always complaining about us. Do we have that same problem with health workers that attend to children that might have the childhood cancers? Do we experience that?
All right. So I did my training in Kolebu, residency training to be a specialist in Kolebu, and I can say that on the cancer ward, the people there are just super. They are excellent. When it comes to empathy, when it comes to patience, the people on that ward, the staff who work there, they are excellent. And I'm sure it's the same with Konfuanoche also. Because you see, they are trained, number one. And then when you see these children and the pain that sometimes they go through, even if they are so, difficult, you're so hardened, you will feel some empathy for these people. So yes, I mean, health workers, we complain about health workers' attitude and all that, but those who manage cancer, at least the ones that I know of, I know that they are good, they are patient, they have all the right skills to take care of these children. And then let me just add a bit to what Tina said about the national health insurance coming in to help. So it's great. It's great. And I got some figures from Konfuanoche, and I want to acknowledge Dr. Lawrence Osei-Tutu. He's a heme oncologist at Konfuanoche. So he and his team, they did some research, and then for cancer, some cancer patients over a period of, I think, 15 years, they noticed that a third of them actually don't follow through with treatment. So they default, yes, they stop at some point. And so they did another study to assess or to find out why they were not coming. And then they realized that a lot of the time, the mothers complained or the parents complained about the cost of transportation, cost of medication, the costs involved in taking care of a cancer patient can be really huge. And I remember that they used to get support from people, other organizations on the cancer ward. And so I would say that people should think, if you have these social groups, religious groups, and you're thinking of helping children, you can also think of helping those on the cancer ward, because those who defaulted, majority of them, it was due to financial constraints. So we should help them in that regard. So it's great that NHIS is helping, and I hope that they spread it to cover all the cancer patients as Tina.
Well, that's good to know. So we are just getting to the end of the show. If you have any concluding remarks for the parents, the teachers, grandmothers and grandfathers who look after our children, any concluding remarks for them?
Yes, so I mean, childhood cancer is real, but it's curable, okay? And it takes every one of us to be able to help these children to make it through. Okay, so it's not just me or the doctors or the team of professionals in the hospitals, but it's all of us. Tell a friend to tell a friend. Okay, these early warning signs can save a child's life. So as individuals, if you see any abnormal sign in a friend's or in a friend's child or a family member's child, try and educate them and spread the news about the early warning signs. And we'd like to appreciate all those who have been supporting these children, especially the religious bodies like some of the churches, some philanthropists who come anonymously to spend their day with them and support some of the children. And even the First Lady who graciously built a mother's hostel for those who come from very far away.
Oh, okay.
And a lot of other...
At Kolebu.
At Kolebu.
Oh, that's great.
Yeah, so a lot of other people who come to help. But these children really need their support and really need their help, because these families take care of these children. They have to leave the other children behind. Sometimes they even lose their jobs because they are not present at their workplace for some time.
And this is something that demands a lot of money. You're losing your job.
So it's a big impact on the parents. And we have just 2 centers, Kolebu and Komfanoche. So people travel far and wide.
Yeah, I did house job in Tamale, and there were a number of instances where if they couldn't get the medication to Tamale, they had to travel all the way from up north to come to Kumasi, which was the closest. And that's almost like 8 hours on the road.
And the money.
Yeah.
And the fact that you have to leave the other children who may need to go to school or be fed, all that is, it's a huge cost, not just on the parents, but as a nation. We are losing a workforce just because we don't have resources available for them. So please, let's come early, because the earlier the better, and the more better the survival rate. And the cheaper it is when you come early. So the earlier the better.
The disease is small, so the money you use is
smaller. So the earlier the better.
All right, okay. Thank you very much. Dr. Gloria, your concluding remarks.
Okay. So I'll say that parents should know, knowledge is power. So learn about these disease conditions and then look out for them. If you see the slightest hospital, if you are not getting answers, go to another hospital. Knowledge is power. So look for things that are going wrong and then seek early intervention. I always say early intervention is very, very important. And I also want to say that support is key. Support is key. So I'm pleading with the governments, as soon as possible, they should spread it to cover the other cancers, and we must help, and we should offer support. Sometimes when people see, I remember there was a time they had a party for the children with cancer, and some of the parents didn't want their children, parents on the ward, whose children were on the ward, didn't want their children to go and take some of the food or mingle with them.
Why?
I mean, the stigma. If child has a cora, chemotherapy, don't shun them. We must support all these people and make the burden a bit lighter. And I want to say that it's good to see Tina again. I know it's good.
Dr. Gloria, today you didn't tell us anything about Healthy Kids Foundation, or you've told us enough.
I have to. So Healthy Kids Foundation, I mean, if you haven't checked us out on Facebook, you are missing a lot. This cancer, information on cancer, you can find it there on our Facebook page. Just look for Healthy Kids Foundation. Like our page and share the information you find there with us. We have loads of education on children's health. And we also have the Kids Eden, which is a therapy center in Kumasi that helps children with developmental delays, so speech delay, children who are hyperactive, children who are supposed to write well but cannot write well, who are supposed to be toilet trained but cannot do that on their own and all that. So developmental delay, if you have any child with developmental delay, reach out to us, and you can reach us on 050-4428-312. So 050-4428-312. Or if you go to Facebook, our contact is also there. You can look for the number and then call us. Thank you.
You're welcome.
And thank you, Mommy, for reminding me.
Oh, I like that you are doing something to help. You are doing something to help the thing you are passionate about. So that's why I always remind you. So we've learned a lot about cancer today. Childhood cancer. It's real. It happens to 1,400 plus children every year. So don't keep your child in the room saying that oyabosomba. No. Don't isolate your children. Don't let the stigma keep your child from getting the help that they need, because as we all know, 80% of them will get killed. So if your child is part of the 80% and you don't seek the help for them, you've done them a great disservice. If you've been watching the Hope channel, you've seen the advert of the Coming King, which will be held at Kaswa on the 12th of October. Invite everybody to come and learn about the Coming King. When Jesus comes, there will be no cancer. Come and learn about the things that will happen as Jesus is coming, and learn about the truth, so that even if your child might have cancer, you be comforted, because you need the comfort. So do well to join us for Coming King, and do well to join us next week too on Hope channel. We will bring you more interesting topics, and we will get to learn more things about your health. It's been a very wonderful evening. Have a good night.
The Seventh-day Adventist Church Ghana presents The Coming King, a 10-day Bible lecture series from the 12th to 22nd of October 2022, 6:30 p.m. each night.
There is a coming king who has answers to all our challenges and cares in this life. You may have your doubts, but that is why I'm inviting you to join us in the Bible lecture